These are the questions you should ask your plastic surgeon before you go in for a tummy tuck consultation. When we are talking about a tummy tuck, it's usually in mothers who have given birth, they have finished their family and do not wish to have more children and now want to go back to their pre-pregnancy weight. It is usually associated with the excess hanging skin in the abdomen, sides and the back. So before you come in for a tummy tuck, you should have thought about how much of an improvement do you want. You have to make sure that you don't want any more children, and then when you come to us, we have to discuss about what you're going to do for the procedure. After childbirth, usually the rectus muscle, which is in the center, splays, because of which the abdominal contents come out, which is why there's a big bulge in the upper part of the stomach. And then you have excess skin on the lower part of the stomach, which is below the umbilicus or the navel. So what is a tummy tuck? When you come for a tummy tuck, you have to first make your plan of action. Your plan of action should be whether the tummy tuck is associated with the liposuction or not. Usually at our center, we combine liposuction with a tummy tuck, which is we do a liposuction of the flanks, the back, to give you a 360 liposuction of the abdomen, and then we do a tummy tuck. So when we do a tummy tuck, we remove the skin from the lower part of the abdomen and pull the upper abdomen down. The scar which is there is under your panty line or your underwear line, so the scar is never going to be seen even if you go swimming in a bikini. You're going to get a new navel which will be completely different from what you had. From a bigger to a much smaller navel you'll go to. You also have to discuss with your doctor about your work situation, your family situation, who's going to take care of the kids, who's going to take care of whether you have a support system or not. All these things are very important in your recovery. And what kind of pain you'll have. The pain usually on a scale of 1 to 10 is about a 3. You have to walk a little hunched forwards in the first 2 to 3 days, after which you can, by the first week, you kind of straighten up. You also have to understand whether you're working from home or physically going to work. It is very important, because if you're working from home, you can start working by the 4th or 5th day. If you're physically going to work, I would suggest at least 2 weeks of rest before you go back to work. All these things are very important for your recovery process. So most importantly, understand along with the surgery, the abdominal muscles which are splayed apart, we bring them to the center. So most importantly, like I said, bringing the muscles back to the center, doing the liposuction, removing the excess fat in the excess skin in the lower part of the abdomen, keeping the scar as low as possible, and your recovery with your family, support system and your work. All these things should be discussed before you go in for the procedure. Thank you.